5 on your health tonight, and as we have been reporting here at News Center 5, a new case of Legionnaire's disease is now confirmed at Beth Israel Deaconess Hospital in Needham. The Mass Department of Public Health says that the infection occurred at the hospital, but so far there is no risk to the public health. As you can see, Dr. T is with us right now. Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you. I know that this is a curveball question, but what gets our attention is at the hospital. They caught that disease at the hospital?
Right, and you don't hear about this a lot. Why? Because we treat our water in hospitals very carefully. The public health officials, Department of Public Health, the CDC gives us very strict criteria of the temperature to have the water, the pH, all of these things that kill Legionella, and that's why you don't hear about this a lot, but nothing's perfect, so rarely something slips through.
So let's talk about it. You've treated patients with Legionnaires, right?
Yes,
before
many.
You've done that
Most
before.
from the community.
And so why do we have to alert the state?
Right, again, it's very important because when you hear about a case in a hospital, Legionella is a bacteria and it likes water, okay? So think about things like cooling towers, large air conditioning. So the reason, again, that we don't hear about it in hospitals, that it's so rare, is because that we're very careful about how we manage our water in hospitals, and that's the key. Yeah. That's why you don't hear about this.
So let's talk about symptoms if we can. Are they typically easy to treat, those symptoms?
The symptoms are that of pneumonia, fevers, cough, shortness of breath, things like that. It can look like pneumonia. The hard part is that a lot of the standard antibiotics like penicillin, cephalosporins don't have activity. So you have to give other antibiotics as well. But we're very, we do see this, and in fact, sometimes it can be very severe in the ICU. So it's treatable with antibiotics, but some patients can get very sick. About 10% can die.
Is there anything, 10% can die?
Yes.
Is there anything that people can do to protect themselves?
Well, one of the things is stopping smoking. If you stop smoking, it doesn't, make it go to zero, but it reduces it significantly. And again, back to what, the truth of the matter is water in other places like fountains, for example, and like cooling towers in non-hospitals that may not be regulated as much, I think there's higher risk for that. But again, we're talking about probably like 10,000 cases a year in the United States. This is not common.
All right, Doctor, great to see you.
Good to see you.
Have a good Friday night.
You too.
Jessica, to you.